Okay, Sophia, let's just dive right in. Dr. Swanson thinks the Rippel Foundation might, have the secret sauce for fixing our health system. That's a pretty bold statement, don't you think?
It is, but I think it's grounded in some really compelling work they've been doing. The Rippel Foundation has this fascinating way of rethinking what a health system actually is. Instead of seeing healthcare as a series of isolated parts like hospitals, insurance companies, and community clinics, they approach it as a complex adaptive system.
Wait, complex adaptive. Hold on. Let's review that again.
It means they understand that the health system isn't static, it's dynamic, constantly changing. Think of it like an ecosystem, all these interconnected players and systems that influence each other. So instead of trying to fix one part, they aim to create conditions where the system as a whole can evolve and improve over time.
Kind of like, okay, stay with me here. It's like trying to grow a garden instead of just replacing a broken sprinkler in the lawn.
Exactly. That's actually, a great metaphor. You don't just throw fertilizer on one flower and call it a day. You want to create the right environment, good soil, enough sunlight and water for the entire garden to thrive. That's essentially what the Rippel Foundation is trying to accomplish with healthcare.
So they're like the master gardeners of the health system?
If you want to put it that way, sure. But what makes their approach stand out is the theory behind it. They're not just focusing on policies or individual interventions. They're looking at the big picture. How do we actually create systemic change? It's ambitious, but I think it's exactly the kind of thinking we need.
All right. I gotta admit, Sophia, calling the whole health system an ecosystem already makes me see it differently. It's like more alive now?
It is, and what's exciting about the Rippel Foundation is that they're not just theorizing. They've spent years developing practical frameworks and strategies to put this thinking into action. Dr. Swanson believes their approach has the potential to address not just the problems we keep talking about, like costs and access, but the root causes that produce those issues in the first place.
I mean, that sounds huge. Huge and, let's be honest, overwhelming. Can you give an example of what this actually looks like in practice?
Sure, but before we get into the specific approaches, it's important to know where this work is rooted, and that's where the Rippel Foundation itself becomes really interesting. Right, so at the heart of the Rippel Foundation's work is this idea of stewardship. It's a concept that reframes leadership within the healthcare system, not as something top-down or dominated by a few individuals, but as a shared responsibility that spans across organizations and communities. They see it as essential for fostering stronger relationships and aligning collaborative efforts, and I think that's what makes their vision so compelling.
Wait, so they're saying everyone's responsible for fixing this mess?
In a way, yes, but it's more nuanced than just spreading responsibility around. Stewardship is about taking intentional actions that guide the system toward better outcomes. It's kind of like being a conductor of an orchestra. You're not playing all the instruments yourself, but you're shaping how they come together to create harmony.
Or, to keep with our earlier metaphor, you're the gardener setting the conditions for all the plants to grow, right?
Exactly. And the gardener doesn't just decide for the plants. They respond to the environment, adapt strategies, and work with what's already there. That's what makes stewardship so powerful. It's fluid. The Rippel Foundation understands that healthcare doesn't need more rigid systems. It needs systems that can grow and adapt with us.
Okay, but isn't it tough to get all these, stakeholders in healthcare to even agree on what needs fixing? I mean, insurers want one thing, patients need another. And you've got policymakers stuck in their own agendas.
You're absolutely right, David, and that's where their vision gets really interesting. They're hoping to change the way those stakeholders interact, not by forcing agreements, but by, creating the kind of conditions where collaboration can happen naturally. They talk about building trust and shared purpose as the foundation for real change.
Shared purpose? That's like healthcare's unicorn, right?
It might feel that way, but I think their vision is grounded enough to make it realistic. For example, they've been working on tools and frameworks that help communities articulate their values together, basically figuring out what health means to them and what they want their healthcare systems to achieve. It's not one size fits all, and that's what makes it work.
Okay, I see how that sounds good in theory, but I'm still curious about how it plays out, when rubber meets the road, or seeds hit the soil.
We'll get there, but understanding their vision is key to seeing how they've approached the actual work. Without that foundation, the practical efforts might not make as much sense.
All right, so we've talked about their vision and what they hope to achieve. But what are they actually doing to make it happen? How are they turning this whole ecosystem stewardship concept into something tangible?
Great question. The Rippel Foundation has been developing what they call practical tools for transformation. One of their major projects focuses on supporting communities to reshape their local health systems using what they refer to as weave the people, align the system frameworks. These frameworks are designed to help people come together, patients, clinicians, policymakers, and create solutions that work for their unique context.
Wait, weave the people? That sounds, a little abstract. What does that mean in practice?
It's not as abstract as it sounds. Essentially, it's about connecting the right people and helping them build trust and shared understanding. The Rippel teams facilitate these collaborations by asking communities to identify shared values like equity or access, and then align their approaches to healthcare around those values. It's a way to get everyone on the same page without forcing uniformity.
Okay, so they're like relationship counselors for the healthcare system?
Sort of. But instead of counseling two people, they're working with entire networks. And they're not just solving disagreements, they're creating the conditions for more productive relationships overall. They provide methods to identify priorities, streamline decision-making, and even, redesign systems around those priorities.
Let me guess. Lots of meetings, though?
Yes, but not the kind of meetings that waste time or just rehash old arguments. They're carefully structured. The idea is to help stakeholders stay focused on long-term, meaningful goals instead of getting bogged down in the day-to-day conflicts. Effective facilitation is key, and Rippel really excels there.
All right. So once everyone's singing Kumbaya, what happens? Do they just go good luck and walk away?
Not at all. They actually stick around, providing continued support through tools and data. For instance, they've introduced ways to measure systems-level progress, which is crucial because traditional metrics like hospital readmission rates only tell part of the story. By shifting the focus to broader outcomes, they're helping communities monitor whether their efforts are producing real change.
So they're also like metric nerds, but in a good way?
Exactly. Metrics might not sound exciting, but they're necessary to understand what's working and what isn't. It's not just about gathering data, but using that data to guide ongoing improvements. That's part of why this work is called transformative. It's not static. Communities can adapt and evolve what they're doing as they learn more.
Okay, but how do they prioritize? Like healthcare has so many moving parts: cost, access, equity, outcomes. Where do they even start?
That's the beauty of their approach. They don't prescribe solutions. They help communities decide what's most important to them. Some might focus on increasing access in rural areas. Others might prioritize affordability. By tailoring their work to local needs, they ensure the solutions are relevant and sustainable for the long term.
I get that. It's smart. But, I feel like health systems love to talk about long-term change, and then, well, nothing really changes. Not to sound cynical, but do they actually have proof this works?
That's a fair question, David. And yes, they do. Communities that have used these frameworks report significant improvements, not just in outcomes, but in the relationships that make those outcomes possible. But I think where their real impact stands out is how they're changing the conversation. Instead of thinking about quick fixes, they're encouraging everyone to think systemically, to ask bigger questions about what health really means.
So, Sophia, we've gone through their frameworks and the approaches they're using to support communities. But here's the real question. What kind of impact has all of this work actually had?
That's a great question, David, because impact often gets overshadowed by grand ideas. But the foundation has quietly built a track record of meaningful change. For instance, one community they worked with was able to reduce emergency room visits by over 25% in just 3 years. And what's interesting is how they achieved that. It wasn't through, expanding hospital capacity, but by addressing broader social determinants of health like transportation and housing.
Wait, housing? That's not exactly what I'd call a healthcare issue.
It might not seem that way at first, but it's all connected. Think about a patient with a chronic illness who has unstable housing. They're more likely to skip treatment, end up in the emergency room, or even face worse health outcomes overall. By, partnering with local organizations to improve housing access, they tackled the root cause and reduced strain on the healthcare system.
Okay, so it's like treating the roots, not just trimming the branches, right?
Exactly. And another example is how they helped a rural community completely redesign their healthcare delivery system. By creating a network of telehealth services and mobile clinics, they increased access for people who used to travel hours for basic care. Within 2 years, the number of untreated chronic conditions dropped by nearly 40%.
Wow, that's actually really impressive. But do they just, pop in, fix stuff, and leave?
Not at all. Sustainability is a cornerstone of their approach. They focus on building local capacity, teaching communities how to maintain and expand these changes on their own. It's not about quick fixes, but creating lasting frameworks that outlive their involvement.
That makes sense. But I gotta ask, why haven't I heard about them before? This seems like way too effective to fly under the radar.
It's a good observation. I think it's because they're more focused on outcomes than publicity. They're not trying to be the face of healthcare reform. They're trying to empower others to lead. It's a quiet yet powerful way to create change.
Quiet but powerful. I like that. So what's the big takeaway for our listeners here? Why does this matter to everyone out there?
I think the key takeaway is this. Transformational change in healthcare isn't about waiting for a silver bullet. It's about creating the right conditions for that change to happen. The Rippel Foundation has shown us that by focusing on relationships, shared purpose, and local solutions, we can move beyond short-term fixes and truly reimagine what healthcare can be.
And that's a wrap, huh? Sophia, I gotta say, this has been eye-opening. I'm gonna go away thinking about my garden analogy way more than I expected.
I'm glad to hear it, David. And, to everyone listening, whether you're a healthcare worker, a policymaker, or just someone who cares about building a healthier future, you have a role to play. Change starts with all of us.
On that note, thanks for tuning in, folks. We'll see you next time on It's Time.